Public health is a practice through action and policy of ensuring positive health outcomes for society. To me, public health could be as small as picking up some litter off the floor or educating and helping your family members reduce unhealthy habits that they may have, or even restricting yourself from doing harmful things that may affect other people around you.
To me, public health is a collaboration with different fields and communities to provide large-scale solutions for our safety.
To me, public health means protecting our community's well-being through nutritional programs at school or safety regulations at work.
To me, public health means education and taking preventive measures such as vaccines to improve community health and to reduce the spread of diseases.
Did you know in the past 60 years, vaccines have helped eradicate polio and smallpox?
What? I did not know that. Thank you, doctor.
You're welcome.
Ouch!
To me, public health is providing affordable health care to all people and discovering ways to protect and prevent the health of communities.
Public health also improves community health and prevents diseases through mental well-being. Mental well-being is how we think, act, and behave in our day-to-day activities, while mental illnesses are serious conditions that affect these daily activities through behavior and emotion. So it is very important to raise awareness on mental illnesses, as it affects how we think socially, at work, or even at school. There's a lot of cultural stigma surrounding mental illnesses, and this is one of the many barriers we need to overcome in order to spread awareness about mental illnesses.
Mom, can I talk to you?
Yes.
I've been feeling really bad and depressed lately. I think I need to talk to somebody.
Don't worry, kid. It'll get better tomorrow. That's just how life is. 12% of Asians mention their mental health problems to a friend or relative versus 25% of whites. This is because mental illness is thought to reflect poorly on family lineage and thereby diminishes marriage and economic prospects for other family members as well. People with mental problems internalize public attitudes and become so embarrassed or ashamed that they often conceal symptoms and fail to seek treatment. Stigma deters major segments of the population, majority and minority alike, from seeking help. Shame, dishonor, dismissive attitudes, weakness are all part of cultural stigmas.
Only about 38% of people receive treatment for mental disorders, which indicates that there is not enough public information readily available, especially among diverse populations and low-income neighborhoods. Resources for access include services such as CAPS here at UCSD, Family Health Services in San Diego, and crisis hotlines. One can also access certain websites to get basic information on mental health and to use it as a directory for other services as well. A couple misconceptions exist around mental illnesses, including people with mental disorders are very violent. Mental disorders last forever. They can't be prevented, and if someone tries hard enough, then they can overcome that mental illness. These misconceptions can be overcome through public awareness and education to get rid of the stigma that is surrounding mental illness. Our communities can also work to provide more resources and access for the public.
How does the healthcare system handle this? The U.S. healthcare system requires that small businesses and individuals have health insurance. This includes mental health, rehabilitative, and substance abuse disorder services, and also prevents insurance companies from denying plans to people based off pre-existing conditions. The ACA builds on the Mental Health Parity and Addiction Equity Act by expanding coverage of mental health and substance use disorder benefits in three distinctive ways. 1. By including mental health and substance use disorder benefits in essential health benefits. 2. By applying federal parity protections to mental health and substance use disorder benefits in the individual and small group markets. And 3. By providing more Americans with access to quality health care that includes coverage for mental health and substance use disorder services. These new provisions enable protections for an estimated 62 million Americans.
The Affordable Health Care Act covers preventative services.
This policy includes behavioral assessments for children and screenings for adults. But wait, there's more. As of 2014, most plans cannot deny you for coverage or charge extra due to previous health conditions. there is an adequate amount of care provided, such as psychotherapy and drug therapy, where people are psychoanalyzed for their behavioral and cognitive development. People can seek treatment by getting referrals from clergy, family medical doctors, or even local community mental health office. These resources include a psychologist or a professional counselor.
Mental health can affect anyone regardless of race, gender, and ethnicity. It can affect how we think, feel, and act. Mental health is important throughout your early childhood through adulthood. There are many factors that contribute to mental health, such as biological factors such as genes or brain function impairment, life experiences such as trauma or abuse, family history of mental health problems, poor prenatal care, stress, drug abuse, and unhealthy family environment. Mental health diseases are not restricted to depression, as it is often associated with ADHD, bipolar disorders, eating disorders, OCD, PTSD, and many more serious illnesses. 20% of youth ages 13 to 18 live with a mental health condition, and an estimated 2/3 of those young people with mental health problems are not receiving the help they need. Suicide is the third leading cause of death for 15 to 24-year-olds and the sixth leading cause of death for 5 to 15-year-olds. Schizophrenia is rare in children under age 12, but it occurs in about 3 of every 1,000 adolescents. Of the 100,000 teenagers in juvenile detention, an estimated 60% have behavioral, cognitive, or emotional problems.